Once you identify this as a problem in a loved one, probably the best approach is to sit down and talk with them about it in as calm and reasonable way as possible. The worst thing you can do is to volunteer to go in and throw things away for them, or to go in and throw things away when they're not around. While doing that, while clearing out someone with a hoarding problem might solve the immediate condition of the home, the problem with the immediate condition of the home, in the long run, these attempts are usually failures, because what happens is in short order the person fills the home up again, and now there is such a strain in the relationship that they're unlikely to seek help or to seek out their family member for help again. So what we advise is that people sit down with the person and try to come to talk through these issues to help to educate them about hoarding behavior as a problem, and about ways in which they can maybe try to do something to reduce the risk that's associated with this behavior for themselves. Now, ideally, the situation would be to get them into some kind of treatment for a hoarding disorder. Oftentimes, people aren't willing to do that. And so the next best thing is to engage them in a conversation so that they recognize this is a difficulty or a challenge, and that they're trying to do something about it. Frequently, what we see is people who hoard recognize this at some level, but they're unable to admit it to their family members because of the relationship that's developed over the clutter with their family member. Oftentimes, people who hoard have spent years doing battle with their family members over their possessions. And so their relationship is colored by these fights they've had. And the person with a hoarding problem tends to be very defensive whenever this issue comes up with a family member. So it's very hard sometimes for family members to be able to communicate with a person with a hoarding problem. So the first thing is to get through that somehow. And the ways that we've seen they're most effective is the person, if the family member pulls back and is not quite so pushy about throwing things away. In fact, in therapy, when we deal with people with hoarding problems, if our therapists, and we do lots of studies where we supervise therapists, but if any of our therapists, if we find them trying to convince the person to throw something away, then we know they're on the wrong track. Because what we want to do is to get this person into the context where they will be making the arguments for why they should be throwing something away. If someone's trying to convince them to throw something away, then we have a dialogue set up where this helper is trying to convince someone to throw something away, and the person is trying to convince the helper of why they should keep the item. And that's not the proper dialogue for any kind of behavior change. The person may agree to throw away a few things here and there just to appease the helper, but in the long run, it's unlikely to have any influence on their behavior. The thing that makes the most difference is when the person decides that they need to do something about it, and they understand enough about the problem. And that's key, I think. Once they understand enough about the problem, they understand that they're going to have to push themselves to challenge their attachments to these possessions to be able to get rid of them. And that's one of the things that we do in therapy. We've also been experimenting lately with self-help groups. And what we're finding is if we can get people on their own to stand up and start challenging their own attachments to these possessions, we do see some positive benefit from it.